I'm Kate Thomson Bowe. I'm a general paediatrician. I work here at the John Hunter Children's Hospital, and we're here to talk today about e-referrals and the value that they bring to both GPs who are referring children, but also to my triage team and to the teams receiving the referrals. The big challenge for us is the volume. There are so many children in Newcastle who would benefit from being seen in the general paediatric clinics, and very few general paediatric clinic availability spots. And so the big issue for us really is about how we pick out amongst all of the children referred who are the ones that we need to see most urgently and provide quick service to. So one of the things that we found is that the value in the referral comes when there's really succinct information that gives us red flags or danger signs that we can pick out, so that the triage team can then identify which children need to be seen most urgently. So for us, we have identified that the e-referral system provides a really quick and easy way of a general practitioner using their software in the community and sending us referrals. They can mark the urgency themselves, and importantly they can include uploading documents, so hearing reports or speech reports, school counsellor reports are really important for a lot of the children who are referred for learning and behaviour problems. But really importantly, we can see very quickly whether there are symptoms or things that might make us need to see the children really quickly, and we can triage more rapidly in that way. But it really comes down to the quality of information that GPs include in the referrals. Traditionally, the old faxed letters and referrals, we would have no minimum condition of information, and there was a real lack of consistency. Some of the letters would be quite detailed and others would be very scant, and it made referrals difficult to triage in a really consistent manner. One of the things that is of major benefit to GPs now is that if the child's condition changes whilst waiting for a paediatrician appointment, new information can be uploaded to that e-referral, so an update in the condition or further documentation. So there are some vast improvements in receiving the new e-referral compared to the old faxes we used to get. Another really good resource for our large group of general practitioners across our district is the community health pathways. They're a system of guidance that are localised but based on international and national guidelines for the community management of various paediatric conditions that might include things like constipation, bronchiolitis, minor surgical things. So the community health pathways are informed by a group of experts, including general practitioners, health administration and paediatricians, to write these health pathways, which then sit available to all of the general practitioners in the community. They culminate in a link to the e-referral system, so that GPs have easy access to our system for referring children if they meet all of the criteria for the community health pathway. We'd like to make a really big thank you to all of the GPs who've come on board. Over the last few years, the proportion of e-referrals has increased enormously, and it really does make a big difference. Any GPs who are new to the area or haven't linked in yet, they can contact their primary health network for support and training. And remember that if ever you're really worried about a child, if they've got an urgent condition, please pick up the phone and call the paediatrician on call.